Welcome to the Cabral Concept, where board-certified naturopath and integrative health practitioner Dr. Stephen Cabral shares how he was diagnosed at the age of 17 with a life-altering illness and given no hope for recovery. It was only after studying and traveling all over the world did he discover how to combine ancient Ayurvedic healing practices with state-of-the-art naturopathic and functional medicine to fully rebalance the body and re-energize it with life. It's time to discover how to get well, lose weight, and finally feel alive again. And now, here's your host, Dr. Stephen Cabral.
Welcome back to the Cabral Concept. Great to have you with me here today. Looking forward, as always, to diving into today's Total Wellness Tuesday show, where the topic is inflammation and how it actually affects the body. So we probably heard about it before. I'm sure you've heard most likely the statistic that 90% of all disease has inflammation as one of its root causes. But you've probably also heard in the Cabral Concept where I say that inflammation cannot be the cause of a disease in the body because inflammation itself is not a root cause. So we're going to get to that today. But since inflammation is highly correlated with most of the disease right now, most of the suffering going on right now in both mind and body, I want to pay it the due that it deserves. So what I want to do today is actually go through all the different parts of the body and how they're affected by inflammation. Then what I would like to do is wrap up the show with connecting inflammation not as a root cause, but as a trigger or a symptom for something much deeper going on in the body. And then as you begin to understand this, you'll know that no matter whether you're treating this from a conventional medicine standpoint or a functional medicine, a naturopathic standpoint, an integrative health perspective of understanding that no matter what, the symptoms are there to show you there's something deeper going on in the body. So we can try to mask those. We can mask them with herbs. We can mask them with ibuprofen. We can mask them with pharmaceuticals. Or we can decide to say, I know it's going to take a little bit longer, but if I figure out what that root cause is, then I won't have these symptoms for the rest of my life. And I won't have to be on the immunosuppressants or the biological drugs that shut down my immune system, because that's what they actually do, in order to mask the symptoms, because that's the reason you're doing it. Let's do a deep dive today. Let's actually look at all the different parts of the body. And I'm going to start with the brain, and then I'm going to move around the body, and then I want to pull it full circle for you today so that you can actually feel like you're in better control, that you understand that these things are within your control because they're happening within your body. The problem is they don't teach us this in school. For sure, they do not. And even though it's taught at a kind of like a superficial level, it's really not taught in medical school as well. So you learn about inflammation, and people might be asking, well, what's inflammation in the first place? That's a great question. So inflammation occurs when there's something foreign in the body or something's happened in the body where the body needs to clean it up. And inflammation acts as a way of basically, you have all different types of white blood cells. And we're not going to get into that for today because we don't want this show to get too deep in the weeds for right now of what our purposes are for the show. So our body will send out white blood cells and it will send it to the infected areas. Now, maybe there's a virus there. Maybe there are heavy metals. Maybe there are plastics and all sorts of different things coming into the body. Or maybe you got an injury. You got hit in the arm, or you got a cut, or you worked out really hard and there was muscle tissue breakdown. So any of those processes of the body where there's a foreign substance or an affected tissue, your body will bring the body's white blood cells there, and then they will release certain chemicals, such as cytokines, in order to clean up the mess. And that allows you to bring more blood flow. It allows you to bring more nutrients, whatever is needed in order to repair the tissue, destroy pathogens, whether it be, again, bacteria, viruses, microbes, fungal-based issues, mold, and that will allow your body to clean it up. So inflammation is a good thing. We always look at it as a bad thing. I don't look at inflammation as a bad thing. I look at it for this reason. One, is it showing me there's something wrong with the body? Now, again, I understand we need to keep it in check, because if we don't keep inflammation in check, things can start to go haywire in the body. But keep in mind, the body is producing the inflammation because it knows something is wrong. So if we suppress the inflammation, what we're really saying is we're not going to try to figure out the root cause, or what we need to do is this. We need to understand that if there's inflammation in the body and we're not even looking at the root cause, we need to say, what's triggering it? Like, what is the trigger for this inflammation? Now, it might be allergies, right? Maybe you go outside at springtime and, you have issues with pollen or ragweed or, whatever pollen, mold, dust, all of the most common allergens, right? So you can look at that and you can say, okay, that's a trigger. But what would trigger the allergies? And you can start to keep working backwards. Like, why is the immune system not balanced? So we look at that. Now, of course, sometimes, because again, I always say this, in life-saving based conditions, there's not a problem with you turning towards whatever is needed to decrease the inflammation. But I just hope that it's for a temporary period of time as you're working on the root cause that will then allow you to wean off the really strong herbals or wean off the really strong pharmaceuticals. That you just go back and you're able to begin to look at things from a root causal level. All right, let's get into the show though. First place I want to start is that mind and the brain. So what happens is our brain can actually get inflammation. We know that it's a big part of dementia. We know that it's a big part of Alzheimer's. We're actually calling, and so I'll kind of lump it in together with diabetes as well. So we can connect this to the pancreas, we connect this to the cell membranes, but diabetes is being referred to as type 3 diabetes. It's being referred to as cardiovascular-based plaque on the brain. There's many different reasons, but the bottom line is this is an inflammatory-based condition. Now, when these inflammatory cytokines start to break down the neural synapses of the brain, and the different connections, we start to see it as autism or poor memory, or we might even start to move into more things like blanket statements such as dementia or multiple sclerosis or mood-based disorders and depression. We know right now, and then this is pretty amazing, and I'm going to get back to this towards the end of the show, but Dr. David Perlmutter, who does a lot of the work in this field, will say bottom line is this: depression is an inflammatory-based condition with root causal levels going back to the gut. And I'll get back to that towards the end of the show. So pretty amazing. Now, again, this is an MD and this is well researched. And we've known these things for many, many years. There's this gut-brain axis, and I want to get to that towards the end of the show, but stay tuned for that because that's such a big part of inflammation. All right, when we're looking at the liver as well, inflammation and buildup of inflammation starts to really do a number on the liver. And here's why. Let's just say there's necrotic tissue in the body, or there's tissue breakdown, or a really hard workout, or let's say that you got an injury. All of these things, anything that's being broken down in the body, in your white blood cells, like it's working basically as the cleanup crew, it's being processed through the liver. And this is extremely important to realize. It's that this is what we talk about liver detox all the time. We just call it a detox or a functional medicine detox, but it's a liver detox. And what you're doing is you're simply supplying your body with phase 1 and phase 2 nutrients. That's it. I'm going to do another show on this because I know we have a bunch of shows on functional medicine, detoxes, how to do it, why to do it. I really want to break it down one more time and have it be like the definitive show that I can then give to our integrative health practitioners, I can give to you, that I can just get the information out to people because it's in the rain barrel effect. I just want to make one show on it, and I will do that. But the reason why I feel it's so important is above every other organ, it's your liver that's keeping your blood clean. Not your heart, not your lungs. Your kidneys are helping, but they actually pick up as the cleanup crew, and I'll go over kidneys next, after your liver is done. So the liver gets first pass, and then things are going to flow through the bloodstream, and they will make their way to the kidneys as well. And that's why there can be issues with your BUN or BUN-based ratios with creatinine on your blood tests, all sorts of issues. But keep in mind, a lot of that has to do with the gut, and a lot of it has to do with liver processing. So when it affects the kidneys, then we're going to start to see things with hypertension, high blood pressure, right? We'll start to see kidney failure. We might see kidney-based infections. We might see kidney stones. That has to do with more just the kidneys themselves, but an imbalance in the blood itself with oxalates and calcium and magnesium and vitamin D and vitamin K. It has to do with all of that. And again, we can't just look at the kidneys themselves, but inflammation in the kidneys really leads to restriction of blood flow through the kidneys. And when there's restriction of blood flow through the kidneys, we're going to get an imbalance in mineral corticoids and the body's ability to respond with normal, even stress response. Super important to look at. Edema is another one. If you feel like your body's puffy, you're holding on to water, or, let's say you put on a pair of socks and you get the lines all over your legs, and all of these things have to do with water retention. And the kidneys are a big proponent and component of that as well. Next up, I want to go over the skin. So many people out there right now have eczema and acne and psoriasis, and they call them sunspots or liver spots. But really, we're talking about inflammation, liver peroxide damage. We're talking about advanced glycation end products, inflammation dealing with, it can be processed sugar, it can be oxidized fats in the body. But what we're showing up as is the wrinkles and the acne and the eczema and the psoriasis and the dry skin and the flaking skin. Well, your skin is one of the best places to show you what's going on the inside of the body. So when there's inflammation on the inside and you're getting oxidation going on, your skin will show that. And you will start to look like you're aging faster. Now, everyone ages, at least for right now. Maybe in 30 years from now, we'll have a lot more, and I know that we'll have a lot more anti-aging for sure. I'm assured of this. I talk with some of my brilliant colleagues that are in genetics right now, and they're in like kind of the futurism of what we'll be able to do with the body. And it's pretty remarkable. We'll actually be able to gene edit to a much greater degree. I know there's CRISPR right now and there's other things, but to a much greater degree. Not just when, a baby's being conceived, but actually, when you're 60, 70, 80 years old. And I think that's great. I really do, for people out there who are trying to live their best and they want to look younger, they want to feel younger. I really don't see it as an issue as long as we're not taking it to too far of a degree where it's not healthy, right? In both mind and body. But your skin, and I'll do another show on this, kind of the lines of the face and what all of that means. It's called facial diagnosis. There's iridology, which is iris-based diagnosis. There's everything from looking at the entire body as a whole. I talked about tongue diagnosis in the past. I'll do one on facial diagnosis soon. But what we're looking at here is your skin is the telltale of what's going on inside your body. And oftentimes, our skin shows that, right? It shows that at whether it's, again, acne. I've spoken about that before with bacterial-based issues, with estrogen dominance, with too high a testosterone. But we can look at a number of things going on in the body that are manifesting on the skin. So important to look at. All right, next one I want to take you through is heart-based issues. So I've spoken about this. I talked about it in the past, but this is really great research to pay attention to. About 50% of the people who have a heart attack have high cholesterol. About 50% of who have a heart attack have low cholesterol or normal cholesterol. So we know cholesterol is not the deciding factor. It's one of, but it's not the deciding factor. The plaque buildup in the arteries does matter. But what also matters is inflammation. And I draw this every time that I work with someone. I know that I drew this in the omega-3 lesson in the integrative health practitioner level 2. But what it looks like is basically you have a tube, and in that tube you have some toothpaste. It's all kind of gunked up. Well, think of that as the plaque in the artery. Now, that's a normal artery. The blood can still pump through it. But think of that same artery now, but squeezed tight. So the toothpaste is still in there. So it's harder. That's the plaque. The toothpaste is basically the plaque symbol. Now you're trying to get the blood around all of that plaque. Well, the inflammation is what squeezed down tighter in the artery. So over time, that actually leads to stenosis or tightening or hardening of those arteries, right? So we get this plaque buildup, we get the atherosclerosis, and we get this hardening of the arteries that happens in time. Well, combine that with inflammation of the kidneys, combine that with inflammation of the arteries, and you have a recipe for disaster. That is how people have heart attacks with totally normal cholesterol. And for the most part, normal plaque. But you can get this stiffening of the arteries. And oftentimes, that inflammation happens under stress, right? So stress, high cortisol, I've seen that in my practice. I work with a few guys right now, and they have a family history of heart attacks in family, late 50s and 60s in their family. Luckily, they're at that age. They haven't had them yet, but we are monitoring those cortisol levels. We're using things such as the Adrenal Soothe product, which has the ashwagandha, it has phosphoserine in it. We're using magnesium. We're using all these things to naturally vasodilate and relax those arteries. And then we're using exercise. We're doing things like fresh garlic to keep those arteries from stiffening up. So important to look at it, because I'm telling you right now, there's multiple ways to talk and think about how the body comes under dis-ease, right? How it gets dis-eased in the body. And so we can't just say heart attacks have to do with cholesterol. Part of it, part of the equation, plaque buildup, part of the equation. But inflammation and what it does and where it comes from is another part to that. Okay, big one right here. Let's talk about the bones and aging of those bones, having to deal with inflammation that affects the body's natural ability to repair the bones. And why don't we do this? We're going to lump in the muscles as well. So when people are dealing with, let's put this all together, because this is what Ayurveda does as well. Bones, muscle, nervous system's a little bit deeper, but let's put all those together. When the body's under attack, when there's massive inflammation in the body, you are not able to build and repair muscle tissue like after a workout. So say after a workout, you work out really hard, you need that inflammation there. It's actually why you should not be doing super high dose antioxidants after a workout or super high dose anti-inflammatories. So you don't want to load up on your turmeric after a workout. You don't want to load up on any of your natural anti-inflammatories, which would be bromelain, boswellia, one of my favorites, turmeric, curcumin, obviously the extract curcuminoids of turmeric. All of these are great. They're all great, okay? But we don't want to load up after the workout. We want the natural inflammatory process to help bring and repair, right? Bring nutrients and also help to repair and clean up all the dead tissue after whatever it might be, an accident, an injury, or just a really hard workout. Now, important to look at that. Here's the other thing though, is when the myelin sheath, so the outside layering of that nervous system starts to get inflamed, you start to get the breakdown there, right? So you start to get the weakening of that nervous system, and all of it could show as MS, but it can also show as carpal tunnel, or it can also show as some type of, what's another big one? Piriformis syndrome or sciatica. All of these things are because of inflammation. And again, bone breakdown or weakening of the bones, osteoporosis, leading to hip fractures. It's because when there's too much inflammation, we have too much catabolism, which means there's too much breakdown. Inflammation is almost synonymous with breakdown, with a catabolic-based state. And if there's not enough anabolism, enough rebuilding, we get too much breakdown, which happens, there's too much entropy. The body ages too fast and breaks down too quickly. Now remember, this isn't happening over days or weeks, it's happening over months and years, which is why people start to age faster once the body becomes depleted of the nutrients it needs and it becomes too catabolic, which is why we're always talking about building the body back up and emptying the rain barrel of all the toxins that it's holding. Super important to look at. I just want to do a couple more with you because I want to show you how all these things are linked to inflammation, but inflammation is not the root cause. Let's talk about one more. I just want to go over one more right now, and that's thyroid. Because we work with so many people typically with low thyroid. A few people, yes, with Graves'-based disease or hyperthyroidism, but hypo is low thyroid. Now, the confusing thing about low thyroid is when you go to your PCP, you go to your endocrinologist, or you go to your natural practitioner, and you run a thyroid-based test, and you look at your TSH. Well, again, it's almost paradoxical, but the higher your TSH, the lower your thyroid. But it makes sense when you look at it from a biological perspective or a pathophysiological perspective, and that's because the higher the TSH, the harder your body is working to make more thyroid hormone. So it makes sense, right? You're low thyroid, so thyroid stimulating hormone, which is TSH, is working hard to actually make more thyroid because your body needs more thyroid. Well, if there is an autoimmune-based condition, and inflammation is present in all autoimmune-based disorders, there's not one that there isn't. So if we look at all autoimmune-based issues, 100% have inflammation as part of what people call the root cause. But again, it's not the root cause. So it's a causal factor, for example, in Hashimoto's, right? In Hashimoto's, the inflammation actually is a direct attack on the thyroid. So now what's going on with the thyroid? Well, we'll actually talk about that in 1 minute. It's a perfect close to the show. But it disrupts the overall thyroid balance. It disrupts the body's ability to actually making T4, which will eventually and hopefully become activated T3. And that activated T3 is where you feel the boost in metabolism, where you feel the improvement in heat and circulation in the body. You get the benefits of weight loss, all the things that you want, right? The healthy hair growth, the normal cardiovascular function, the normal cholesterol process. All of these are needed with the healthy thyroid. They go hand in hand. So you see a lot of people and they'll have high cholesterol. And I say, well, do you have low thyroid? They say, I don't know. Why would thyroid have to do with cholesterol? Well, the two go hand in hand. And then I also say, well, what's your vitamin D look like? Because your vitamin D affects both your cholesterol and your thyroid. So that's why, again, everything is connected. Now, low vitamin D can actually be a causal factor, but inflammation cannot. Low vitamin D can actually lead to higher inflammation. So that's why we want to look at this. So yes, Hashimoto's is an autoimmune-based disorder, but it has root causes to it. And those root causes could be viral-based. They absolutely can. They can be heavy metal-based, especially arsenic or mercury or bromides. All of those things matter, and they do affect the thyroid, hands down. Without a doubt, they do. Okay, so when aluminum affects the thyroid as well, we want to look at those. We want to test for those. Do you have those? Yes or no? We can look at them. But also, so does stress. High levels of stress can affect the thyroid because it affects the adrenal glands or the HPA axis. And we've talked about this before, but when you start to produce more norepinephrine or adrenaline, those are called catecholamines. That actually starts to block and slow thyroid function in some people, not everyone, right? Same with what's called glucocorticoids or cortisol. Under stress, the body can actually convert normal or active T3 to reverse T3. So when we get reverse T3, we're not able to use that. So now we have lower thyroid. But again, it can come from stress. But this stress, and especially when we're talking about autoimmune, and we're talking about 100% of autoimmune have inflammation. Okay. But 90% of all autoimmune have gut-based dysfunction. So that means it has some type of leaky gut or gut-based permeability. And this is an important way to end the show because we already know that dementia, Alzheimer's, and a lot of brain-based issues have to do with the gut, that gut-brain axis. It affects mood as well. And I want to quote a few studies here. This is important to look at. Shows always get triggered by research or someone asked the question within our community, or I'm doing something for the integrative health practitioners and I want to do like a follow-up podcast. I want to get into the material as well. So David Perlmutter is a neurologist, and he looked at how our gut bacteria, we know it affects our overall health. So we know it affects our immune system. Remember, 90% of all autoimmune issues have the gut-related issues and leaky gut or intestinal permeability, whatever you want to call it, as one of the causal factors. We know that. We've seen it. We've seen the research. I quoted it in the rain barrel effect. In the rain barrel effect, there are something like 250 or 300 quoted research studies. I mean, it's all there. That's why I love the research. And people say, can you do this? Can you do that? The Cabral Concept is about bringing this information out in a usable, chunked down, digestible way to the world. If you want all the backed up research, it's in integrative health, but it's mainly in the rain barrel effect. It is just quoted. There was one chapter alone with over 40 citations. So it is there. I want you to look at it. I want you to absorb it. But remember, I want you to be able to use this information in your real life. And if you're a practitioner, I want you to be able to use it in your practice. That's what this is all about. But this is a direct quote from Dr. David Perlmutter. Depression is now considered an inflammatory disorder. We now understand that inflammatory markers of inflammation that we see in heart disease also seem to be elevated in the depressed patient. So the question would be then, if depression is an inflammatory disorder, where does this inflammation come from? So it's interesting because while I agree that depression has an inflammatory component to it, there's so much more. And we can't say, and it says, so I love it says, where does the inflammation come from? Because depression is not an inflammatory disorder. And that's where I just disagree slightly, at least where Dr. Perlmutter was quoted. I don't agree that it's an inflammatory disorder because almost everything's an inflammatory disorder. That's what I was quoting here today. That's what I wanted to show you. So if you have an autoimmune disease, if you have mood or brain-based, if you have joint pain, if you have anything, it's an inflammatory disorder. So I agree. I agree with that. However, it's not root causal. So what we need to do is ask, where did the inflammation come from? Always ask, where did the inflammation come from? And I want to give you a place to start. If you haven't looked at the gut, it needs to be your first place to look. After this many years in practice, I'm always saying I need to rule out gut permeability first. Because here's what happens, that bacteria, proteins, and other particles that aren't supposed to be outside of the gut wall can escape through the gut in a few ways. So one, they can move through a process which is simply called transcellular. And that's typically reserved for the healthy things that our body can absorb. Immune cells can go through the cell wall. Nutrients that our body needs can go through the cell wall. And then we have something called paracellular. Now, paracellular is slightly different. And we've talked about this before. Our gut is essentially a single line of cells, one cell. But between those are tight junctions. Over time, with antibiotic use and with stress and poor food combining and birth control and the Advil, the ibuprofen, pharmaceuticals, tap water that contains chlorine or fluoride, pesticides, all of these things can begin to break down the gut wall in a way that it starts to open up those tight junctions. Now, what was supposed to be the outside of our body allows particles that were never meant to be on the inside of our body, which is basically our bloodstream. Let's just look at it like that, which can then be transported to anywhere in the body. It could go to the brain, it could go to the thyroid, it could go to the bones, it could go to your muscles, it could go to the joints, it could go to the myelin sheath. That is when genetics matter. People ask me all the time and they say, no, it's just genetics. My whole family had it. Yes, your whole family has the same genetics. I get it. So does mine, right? So does mine. But what caused it? What set off the genetics in the first place? Because I know you didn't have that when you're 6 years old, most likely. So why do you have it at 46? Well, something set it off. And now we're seeing things happen at 16 and 26 and 36, right? We're not seeing these things at 66. We're seeing it so much earlier because there's so many more toxins. there's so much more inflammation, right? There's so much more stress on the body. These are all stressors. So what I say to people is look to the gut first. Work with your local integrative health practitioner, functional medicine doctor, anyone that really specializes in the gut, right? That will work. Naturopathic doctor, run an organic acids test, run a stool test. You can also run a food sensitivity test if you'd like. These things will look at where the gut-based dysfunction is, if there is any. You're not going to do an intestinal biopsy. That's going to be too intense. You don't need to do that, right? What you need to look at is what's going on. Fungal overgrowth, parasites, bacterial overgrowth, H. pylori, which one of those? Or all four? Like which one do you have? And then you can go about fixing that, sealing up the gut wall, and I think you'll be surprised. I think you'll be surprised that there is a great cessation in your symptoms, and over time, those symptoms start to go away. As you begin to heal the gut, so much else changes within the body, and your body's able to keep up. The liver now does not have as many things spilling out in the bloodstream. It does not need to work as hard to remove those things as well. So I could go on and on, but I want to keep it at that for today. And really the understanding that, yes, everything is an inflammatory disorder. And we know now depression is as well. But we also know that a lot of these issues go back to the gut. So if you could start one place, yes, you can do heavy metal testing, and yes, you can look at overall toxicity, and you can look at cortisol levels. And I agree, you should do all of it if you can. The big 5 labs are a great place to be. I mean, they really are. Like that will tell you all you need to know. High levels of omega-6, it will tell you that. But if you can only start in one place, I think the best place to invest is looking at your gut-based dysfunction. And if you do that, then you'll be able, process of elimination, it's not parasites, it's not H. pylori. Okay, I do have some yeast overgrowth, but I have a lot of bacterial overgrowth. Okay, now you can go about fixing that. You know what to fix. And then once you're done removing that bacterial overgrowth and then repopulating in the right way, not just nilly-willy using probiotics without removing first, then you can begin to seal up that gut wall. And as you seal up the gut wall, less will seep through. If less seeps through, there's less of an immune reaction. If there's less of an immune reaction, guess what? There's less inflammation. Hopefully today's show was helpful. Thank you so much for tuning into another show. And of course, if this was helpful, please do feel free to pass it along to anyone else you believe it could serve. Did you know that the body really only becomes sick or imbalanced in only 2 ways? Over time, you become deficient in vital nutrients, and you also accumulate toxins internally and from the environment. As those nutrients diminish and you increase your total toxic load, your body then begins to show the first signs of dis-ease. It's actually quite predictable, and the good news is that if we know how you began to fill up that proverbial rain barrel, we also know how to empty it to begin the healing process. I was fortunate enough to learn this ancient healing process from my mentor after suffering from debilitating diseases for close to a decade. It was only when I began to implement these techniques did I finally overcome my illnesses and go on to live a life of energy and vitality that I now enjoy. I'd like to share with you now what I discovered after traveling all over the world and how to combine the best of ancient healing wisdom with state-of-the-art science. Allow me to teach you exactly how I've been able to help over 250,000 people to empty their rain barrel and begin to transform their body and lives into what they've always hoped they could be. To get your copy of the international bestseller, The Rain Barrel Effect, simply go to stephencabral.com/rainbarrel.